Even though the most important differential diagnosis of prolonged chest pain is acute myocardial infarction, the following disorders have to be ruled out. Aortic dissection. Check peripheral pulses for asymmetry. Pericarditis. Pericardial rub may be transient. ECG changes may mimic myocardial infarction. Atypical anginal pain associated with hypertrophic cardiomyopathy. Esophageal, other upper gastrointestinal or biliary tract disease. Pulmonary diseases. Pneumothorax, pulmonary embolism with or without infarction. Pleurisy, infectious, malignant or immune disease related. Chest wall disorders. Skeletal, neuropathic, root pain. Psychogenic, somatoform pain disorder.